Hello, my name is Dr. Paul Scheiwiller. I'm an anesthesiologist here at the Institute of Orthopedic Surgery. I'd like to talk to you today about a continuous brachial plexus block. This has been ordered by your surgeon for your postoperative pain management. Before we get started, I'd like to introduce you to members of the team. You will meet, if you have not already, an SBA. An SBA is a special blocking assistant, will be assisting me by assisting with positioning, prepping, and assisting during the procedure. She will also monitor you before, during, and after the block, and she'll be providing for your comfort. Very shortly, you'll be meeting an anesthesia provider. This will be the person that will take you back to the operating room, get you off to sleep. They'll be watching you, monitoring you during your operation, waking you up, and then taking you to recovery room. This procedure has been designed with your comfort and safety in mind. The nerves that innervate the shoulder are located in the upper shoulder, lower neck region, as indicated by the arrow. This is where the block is performed. This is a very simple procedure. It will take less than 15 minutes to complete, and the block will last about 3 days. It's important to keep in mind that the block is designed to do what we call stepping down, or step down. That simply means the block will decrease in intensity after about 24 hours. We make the block extra strong today. The block, in other words, is souped up because this is the day that you're going to have the most pain. Most of the feeling will return in the hand as well as movement in the hand. This is by design. Be prepared for this. This is expected. You will be positioned initially on your side. We're going to ask you to slide all the way up against the rail and all the way up to the head of the bed. The bed will then be raised. Please let your arm hang and relax. This will facilitate the procedure as well as make it very comfortable for you. Next, the SBA will prep and drape the area. An ultrasound probe will be placed over these nerves. The ultrasound machine allows us to actually look underneath the skin and see the nerves. This is extremely helpful. Then we place a numbing shot in the skin with a tiny numbing needle, which is roughly the size of what a diabetic would give themselves an insulin injection with. I will warn you before we do this. Then a special block needle is placed through the numb skin and is directed to the proper location. All this is done with ultrasonic guidance. Medication is injected. Then a small plastic piece of tubing, which is roughly the size of a fishing line. This tubing is hollow and has holes at the end of it, is passed through the needle and placed between the nerves, again, while watching on our ultrasound machine. You won't even feel me put the tubing in. The needle is withdrawn and the skin is sealed with a special glue. A pump is hooked to the tubing. It will infuse slowly around the nerves for up to 3 days. Remember, the block is stronger today than it will be on the following days. There is a button to push if you feel like you need more pain medication. In addition to the block medication, you will be sent home with a prescription for pain medicine. Please start your pain medications prior to the block resolving. You will receive specific recommendations at discharge. Removing of the block tube is very simple. Just simply start at the end of the connection. Slowly remove the tape. A clear, crusty scab will be located at the end where it goes into your skin. Just pick this away very carefully. Many times it just falls off. Pull gently towards the back. Verify that the tip is intact, and that's it. There will be about 2 to 3 inches of the tubing in you. The area of numbness is illustrated by my hand. The area under my hand is where you will be numb. Underneath my hands in this photo is an unblocked area. The area here is important because this area does not get the block. Surgery many times is performed through these areas, as the surgeons will place poke holes to place their instruments through unblocked areas. Many times fluid will leak out during the operation, and these areas may sting and burn. It's generally not too painful, it doesn't last very long, and we'll provide you pain medications if this is uncomfortable for you. You will notice that your arm is becoming very warm, and it will be getting very heavy soon after the block. Your hand, especially the thumb, may also come along for the ride. Again, this is not a hand block, but these nerves all run together in groups. And again, this is temporary. Side effects, if they occur, last 3 days. These include: you may notice warmth on the side of your face, your eye may become bloodshot and droopy, your nose may become stuffy, your voice may become hoarse, and there is a long nerve that goes down to your diaphragm that sometimes gets a little sleepy from these medications. You may notice a sensation of shortness of breath. This is many times relieved just by simply sitting up. If you sit up and this shortness of breath sensation is still bothersome to you, then we recommend turning the block off. Turning the block off, we will show you how this is done before you leave. It will take about 8 hours before the shortness of breath disappears. Be extremely careful with your numb arm. Protect your block extremity from excessive heat, sharp objects, hard or pointed surfaces, and unless otherwise specifically directed, keep your arm in the sling. Use a pillow or a soft cloth or a towel to protect your elbow, and just think of your arm as a newborn baby, and just protect it just as you would if you were carrying a newborn child. The benefits of the block extend into the operating room also. You'll generally require less anesthesia and pain medication during the operation. This means generally you'll wake up quicker and you'll have less nausea and vomiting. You'll be ready to leave our recovery room area quicker, and you'll have significantly less pain post-operatively. Anytime we place a needle in anybody for any reason at all, there is a small amount of risk. This includes damage to surrounding structures, veins, arteries, nerves, muscles, also risk of medication reaction, and infection. However, these are the reasons we use an ultrasound machine, special block needles, injection techniques, and we monitor you very carefully during and after the procedure. A few housekeeping items. Your guests will be asked to exit. We will bring in our equipment, an ultrasound machine, and several trays of materials. You'll be hooked up to monitors, EKG, finger clip, and blood pressure cuff. We understand if you're nervous, it's perfectly normal. We're going to take great care of you. The nurse will generally provide you with a light dose of sedation, which is roughly equal to 2 drinks, or I like to say Bud Lights. This is given before your procedure through established IVs. If you go home with this block and you have questions, please don't hesitate to call us. The phone number is provided on your handout. There'll be plenty of time for me to answer any questions that you may have, and please don't hesitate to ask. That's what I'm here for. And I look forward to meeting you, and I appreciate your attention. Thank you.